Hi there, my name is Dr. Oliver and welcome to the Ozone Skin Center. I'll be your dermatologist for today, and I thought I would just explain a little bit about what we do. So, a dermatologist is a doctor that specializes in the prevention, treatment, and diagnosis of certain skin conditions that affect the skin, hair, nails, sweat and oil glands, as well as mucous membranes within the inside of the mouth, the inside of the nose, as well as the eyelids. It's also interesting to note that the skin is the largest organ in the body, and it has a very important function of acting as a barrier against particularly harmful or potentially harmful bacteria, substances from entering the body and causing harm from there, from entering the bloodstream. There are multiple specializations that dermatologists can have. For instance, cosmetic dermatology, immunodermatology, or dermatopathology or dermatopathology. So, I see that you were booked in today for a general head-to-toe skin check / exam. Is this correct? Okay, I see. Well, you've definitely come to the right place. That is something we can check out for sure. And were there any other specific things that you were concerned about, or skin conditions or areas of the body that you would like me to assess as well? Okay, I understand. So just to clarify, it would be your bit of dryness in the facial area from sort of this side or that side, or... Okay, so mainly all over in general. And may I ask, how are the lips? Is that area also quite chapped or dry? Okay, I understand. Yeah, so general dryness all over across the face as well as the lip area. Upper and lower lip. Okay. Well, there's definitely something we can check out, and more often than not, there's usually no underlying disease or pathology that we should be pressing more deeply. Generally, this is caused by environmental factors such as being in a dry environment consistently, or potentially even not hydrating enough and not drinking enough water or fluids. But you are right, it is definitely a valid concern and a valid thing that we can take a look at today. So, before we move on, I just had to ask a few questions just so I can gather a bit more personal details about your past medical history, any existing conditions, things like that. Yeah, what we call a subjective examination, where you tell me what you have experienced or have. Sound okay? Well, let's gather some history, like I said. And I've just got my notebook here. I'll be recording down some questions and answers, if that's okay. So, just let me know if you're aware of any of the following skin conditions, if you have them. So, we'll start with atopic eczema. Are you aware? Okay. How about acne? Anywhere in general? Okay, I understand, yes. Write that down, just so I don't forget. Yep, Good. And then psoriasis. You aware of any psoriasis? Okie dokie. No dramas. And lastly, dermatitis, or inflammation of the derma or the skin. Inflammation of the skin. Okay, so no dermatitis that you know of. Yes, of course. I see. Well, thank you for that. I'll just jot down the notes. Perfect. And fun fact, did you know the epidermis is one of the two main layers of the skin and is the most superficial, or the one you can see is closest to the skin. Well, it is the skin, the epidermis. And then underneath that, or deep to it, anatomical term, deep to that layer is the dermis. And as we will be using gloves for today's session, do you have a latex allergy by any chance? Okay. Well, even if you aren't allergic, I will still be using a different material other than latex today. It can just be a little bit less invasive and a little bit more sensitive to the skin than the rubber of the latex. Hope that's okay with you. And I'd just like to say that throughout today's session, or dermatology skin check, I wanted to reassure you that we won't be performing any invasive or painful techniques. In the unlikely, highly unlikely event that we find something of note, we may have to perform a very small, painless, quick surgical procedure known as a biopsy, just to get a small sample of the skin area. However, like I said, this is in the very, very unlikely case of there being something of note. Yeah, very, very unlikely, sorry. Especially based on what you've told me in your history. But I just thought I'd let you know anyway, just in case. So there's no surprises, no tricks. I'm not a magician. There's no reason for you to be alarmed. Yeah. But like I said, very, very, very minimal chance of that happening today. Well, in any case, I'll just get my gloves on. I did drop one. I just have to pick this one and get a new glove from the box over here. Here we are. I'll just slot these on, and why don't you just go ahead and have a seat there while I get these gloves on. Never gets any easier getting these on. Okie dokie. Perfect. Well, yeah, just there. You're comfortable there? Good. It's not too cold in this room, I hope. Yeah. Perfect. Well, we're just going to begin by checking your scalp region for any moles or any areas there. Sometimes they can be quite hidden, yeah, especially because the hair's there. So let's just have a quick check in through the scalp region. Just trying to relax as best you can for me now, please. Just having an inspection now. As we're looking through your hair, we are looking for what's called the ABCDEs of skin checks. So A standing for any asymmetry between the mole that may be there. B, looking for any irregularities of the border. C, just making sure there are no irregularities in the color or multicoloring of a specific area. D, yes, so the ABCDEs, we're looking for any asymmetry of the areas or moles making sure that it's the same on both halves. We're also looking for the border. That's what our B stands for, making sure there are no irregularities in the border and it's nice and even, it's not jagged or irregular. Next we check for the color, any multicoloring or discoloring. Exactly. And then we look at D, the diameter. Generally things more than 6 millimeters in diameter, things we want to check a little bit more closely, but things that are smaller can still be worth looking at, of course. Okay, how are we going there, by the way? Are you still comfortable in that position? Very good. All right, let's continue. And lastly, looking at the E, or the evolution, or how the mole area might be changing over time. Yeah, that can also be something to look at. But our scalp seems pretty clear. No issues there. Yeah, it's a bit of a scalp massage in the process, I guess. But I would actually encourage you to perform these regular skin checks on yourself. So of course it's easier to see parts of the body that you can see. That's where we come in as dermatologists, just checking the areas that you might not be able to see as easily, such as your scalp, of course, or your back, for instance. But we'll just have another quick comb through in that area. And that's looking pretty good. Excellent. Alright, so just a quick check for your ABCDEs. Any asymmetry, looking at the border, the color, diameter, as well as its evolution. So just something for you to be mindful of and start to get into the habit of practicing regularly for your own health. Very well, looking good. Okay, now I will just use one of my little tools here. It has got a little light. It's known as a dermatoscope or dermatoscope. I say dermatoscope, but it's just going to use it to get a better look at one of your areas there. Doesn't look like anything to be concerned about, but I can never be too careful. So I'll just come in here with this light. Yeah, that's it, nice and still. I just want to have a quick, that's it, a quick glance, but a detailed glance and investigate that area there. Okay, yep. Alright, have a brief pause there. You're still okay in that position? Yep, everything makes sense so far, I hope. Yeah, let me know if it doesn't. I can re-explain things if needed. Okay, let's continue then. Just using the dermatoscope a little bit more and through that area. Just want to make sure and be 100% clear. Okay, well, thankfully that looks all fine. No irregularities or abnormalities with that ABCDE checklist that I just briefly explained to you. However, I would just like to take a photo, something we can store on our online database and something that you will be able to access, just so we can cover the E of the ABCDE checklist, just in case there are any changes over time. I would encourage you to have a follow-up appointment in a year's time, and also to have someone check it regularly, maybe a loved one or someone you are close to, just to monitor and see if there are any changes over time. But for the time being, we'll just take a brief snapshot of it so that in a year's time we can compare and look back and just see if there's any changes that we should be cautious of or wary of. So I'll just have a bit of a click, that's the one, and staying where you are, click, good, and just one more photo for you there, slightly different angle, click, excellent. Well, that is all clear, and there won't be any need for one of those biopsies or one of those surgical procedures that I mentioned earlier. Like I said, highly unlikely that we would be performing that with you today based on your past medical history. Past, not past. Past with a T, of course. Well, we're going to have a look now at your face. You did mention that it was feeling a bit dry, as well as your lips. So, how do you feel about your skincare routine at the moment? Do you have one, or... It's okay, you can tell me the truth. I'm not judging here. My job here isn't to be a judge. I'm here to help you. Yeah, so feel free to tell me whatever. Exactly, yeah. Okay. So been quite dry for some time now. May I ask, are you taking like hot showers or anything? Regular hot baths, perhaps? Okay, yeah. Sometimes that constant hot pressure and hot water rapidly hitting the face can dry out the layer of the skin there. Yeah, it can definitely contribute to a bit of that dryness in the facial area. Now, I'll just get you nice and close here and see what is happening in particular. Just hold nice and still. Yeah, that's it. Okie dokie, I can see, yeah. So quite dry, mainly through like the cheek area there particularly. Yeah, I see. Well, if we are constantly having these hot showers or not drinking enough water or in dry environments, like I mentioned at the start, then we can definitely experience a bit of dry skin, such as in our case. So, what I will do today is I have some lip balm here. We'll address the dry lips first. Just some vanilla lip wax here for you. I'm not sure if you can see that. Yeah, that's the way. Pure, yep, environmentally friendly, of course. Yeah, we will be just applying some on the lip area there, just to make sure that it is nice and hydrated, and also smells and tastes nice when you get out of here. So I hope you're a fan of vanilla. Yeah, let's just apply some in through there. Excellent. No worries. Yep, that feels okay. You can probably feel a bit of a difference there now, actually. Yeah. Okay. Awesome. Right, and now I notice, yeah, like I said, a bit dry in through the cheeks there. Let's just use some of this moisturizer here for you. Just apply some of that on some areas of your face there. So just give that a bit of a gentle tap out. And okay, so just over on those areas there. Or just gently massage those into your cheek and forehead and philtrum, jawline, all those areas, and the nose especially. Sometimes the nose can get quite dry. I sometimes find that in my case as well, so you're not alone. Anyway, here we are. How's that feeling so far? We can probably feel the difference quite quickly, to be honest. Yeah, I find that this product works quite quickly. Okay, I'm glad that's feeling a bit more moisturized. Just one little spot up the top there. Make sure that's all rubbed in. We don't want oily skin. It's also something to consider when you're buying your skin products or routine, the type of skin that you have as well, because that can affect the outcome, of course. So definitely worth taking a bit of time to be aware of how your skin behaves to certain products. Well, I'll just remove these gloves. They are a bit dirty now, and we are almost done with our skin check examination. You still feeling okay there? Yep, have a bit of a breather. I'll just write down some of the notes pertaining to today's results. Just a few mental reminders for me too. My memory's rather on the poor side sometimes, so we'll just jot these down. And while I am writing this, I just want to remind you that that snapshot photograph we took of that little mole will be available for download and viewing completely free on the Ozone Skin Center website. Just have to go through a few things and access the patient portal, and then you'll have access, lifetime access, I should add, to view that photo, so you can constantly check that every few months. I would recommend. Yeah, exactly. So I'll just finish up here, sign off on a few things. Red tape, you know how it is. Okay, perfect. Right. The other thing I would recommend as well, just in general for the skin, starting to use some exfoliating scrubs. Have you got any of those in your arsenal? So yeah, something like this, bit of a facial sort of scrub that you can use a couple times a week or once a week. Yeah, I would recommend anything in particular. It doesn't have to be this specific brand or anything, just whatever you find that is suitable for your skin type, of course. And lastly, I would recommend just a daily wash that you can put through and wash nice and into your face, just to get rid of any dirt, moisture, oil buildup that might be getting into the pores on a regular basis. Exactly. Yeah, just a regular skin routine. Yep, exactly. Earlier the better. So you reap what you sow, don't you? What do they say? The best time to start and plant a tree was 20 years ago. The second best time is now. And I guess that applies for a lot of things in life, but in this particular scenario, it is our skincare routine. So anyway, thank you for booking in to the Ozone Skin Clinic or Skin Center. I want to show my appreciation for you to come in today. It has been quite busy, so I'm glad I could fit you into the schedule. In any case, I would recommend you see Barbara out back, or at front rather, I should say, a receptionist, and just book in for a annual or next year for another checkup with myself. Okay, well, once again, my name has been Oliver. I've been your dermatologist, and I hope you have a wonderful rest of your day or night. If you enjoyed this roleplay, please give the thumbs up button a click, and if you would like more of this content, clicking the subscribe button would be awesome too. Take care.